and welcome to my YouTube channel. My name is Joanna the nurse, and today I am going to do a video that no one has really asked for, but yet all of a sudden I feel like inspired to make this video because I think it can help answer a lot of people's questions about misconceptions about filler and Botox in general. So I get a lot of comments, and I see a lot of comments too, whether on Instagram, email, like patients that come to see me, and quite simply a lot of people just aren't too familiar with Botox and fillers. So I think this video is a great way of kind of introducing and answering a lot of questions, and they're very commonly asked questions, and we can just kind of go from there. Sorry, that didn't really make sense. Oh wait, hold on. Before I do that, let me just say that this is in no way to like try to encourage people to try filler or try to discourage people in trying filler. This is just, you know, what I've been educated about, what I'm knowledgeable about. This is my job. I do this every single day besides Sundays and some Saturdays. With that being said, let's start. Okay, so misconception number 1, filler hurts. So filler and Botox, it is injected into your face with needles. Some people have needle phobia, some people don't. Some people have a higher threshold for pain, whilst others don't. So I would say pain is a little bit subjective. Some people tolerate it very well. Some people are a little bit more uncomfortable. But I will also say that it's not typically as bad as people usually think it's going to be. And not only that too, but we do use we do use topical numbing cream in office, and there is lidocaine inside pretty much all of the syringes that we use, at least a filler. And Botox is just quick little pokes, so it's never terrible. However, you know, it is a needle going into your face. Question number 2, or assumption number 2, Botox causes bruising. Botox and filler can definitely cause bruising. You have to think again that we are injecting a needle into your face. It causes just trauma in general. If you get hit, you know, with a table, then you are going to probably get a bruise. If you get poked with a flu shot, you may get a bruise. Same thing with an IV, same thing with a blood draw. So you have to think that yes, filler and Botox can definitely cause bruising. I always say expect bruising and swelling. If it doesn't happen, great. Consider yourself lucky. However, it can definitely happen. So it's your face. it's so vascular. So the chance of bruising and swelling happening is likely. Number 3, when it wears off, your wrinkles are more prominent. So actually, and I'm assuming that this is talking more so about Botox. Botox is a muscle paralyzer, so it will paralyze the muscle. So actually, when it wears off, it's quite the opposite. Over time, if you continue to do it, your wrinkles should get better, because now not only are you paralyzing the muscles while it's working, but you're not making that expression as often, so those wrinkles will get better with time. So actually it's getting better, not worse. So that was a question I got a lot, actually. Okay, exception number 4, it will make you not be able to drink stuff. So I'm assuming that you're thinking about lip filler and that you can't drink fluids after getting lip filler, and I can tell you that you can. So you can definitely drink water, whatever you want, you can. Okay, number 5, that once you start, you have to continue, otherwise your face will look off. So no, it depends again on what the person is injecting in your face. So for me, I use pretty much all hyaluronic acids, I use some calcium, and I also use such as radius, and I use botulinum toxins. All of them dissolve, all of them go away on their own time, so it shouldn't make you look off. However, sometimes people get used to having like a certain amount of filler or Botox in their face, so they think that they might look different when it comes off, but in reality, it's you just kind of got used to a new baseline, I guess. So, but usually it does all goes away eventually over time. Number 6, after a while, Botox stretches the skin. So Botox does not stretch the skin. Again, it is a muscle paralyzer, so it doesn't stretch the skin to start with, so I don't think you need to worry about that. Number 7, filler or Botox is more noticeable on male patients. Actually, for that one, it depends on the male patient. It depends on their facial volume, it depends on their starting point, their anatomy. But I can tell you, for example, Botox, sometimes men actually need a higher dose rather than a smaller dose than women. And that's simply because their muscles are a little bit more overactive, so they just need a little bit more. So actually, I would say for the most part, it's a little bit less noticeable on male patients than women patients, and sometimes male patients just simply need a little bit more, but again, it all depends on the patients. Number 8, you will look fake, really unnatural. I mean, you can. So you can definitely look fake, unnatural after fillers or Botox. We are, adding volume, we are paralyzing muscles, we are doing all of that. However, done in small doses, and keep in mind that 1 syringe is 1/5 of a teaspoon. It is a tiny amount. It could barely fill right here for my finger. Small amounts. So doing even like 5 syringes on your face, your cheeks, your smile lines, your lips, your chin, it's still going to look relatively natural because it is a small amount. So don't worry so much about looking unnatural. A lot of times my patients, they come in, especially first timers, and they think, oh, please don't make me look like a duck. Please make me look natural. And I tell them 1 syringe is a good starting point. It is a small starting point. Chances are you will look very natural. Chances are you will end up wanting more. And it's not because it is addictive or anything like that. It's simply because 1 syringe, 2 syringes is a lot smaller than people think. Again, 1 syringe is 1/5 of a teaspoon. So chances are you will end up wanting more, not less. What was it? Botox is temporary. You need to keep getting it. So I highlighted that need because you don't need to do any of this stuff, and you don't need to continue with anything. However, I will tell you that it is temporary, but a lot of times the patients, they love the results of it, and so they do want to keep on getting it. And it's not because they need to, it's simply because they want to. Okay, is it true you have to start Botox from a young age in order to prevent wrinkles? So it is preventative. So my patients that they're in their early 20s, they are making movements, they're frowning, they're raising their eyebrows. So of course, starting Botox at a younger age, it's not going to create those deep set wrinkles that someone who is 60 years old who's never had Botox tend to have. However, it's not, you don't need to get it at an earlier age to prevent it from happening. Some people are in their 40s and they have no wrinkles, and some people are in their early 20s and they have a lot of wrinkles. So again, it just depends on your natural anatomy, on whether or not how old you have to be to start getting it. And again, it's always up to the patient. Number 11, 1 syringe won't make a big difference if you have very thin lips. So in my experience, 1 syringe is just small. It's a very, very natural amount, whether or not you have bigger lips or smaller lips. Another thing that is surprising to a lot of patients, including myself when I first started injecting, is that the bigger your lips naturally are, the more you tend to need for lip filler. And the reason I say that is because think of your lips as, if you have bigger lips and you lose volume as you age, they look like, think of it as like a big balloon, right? You need more helium to fill it. Whereas think of smaller lips, I keep spitting, sorry guys. Think of smaller lips as like a water balloon. You need less to fill. So the bigger the lips are, the more volume loss there tends to be, the more filler you need to see a difference. Whereas someone with smaller lips, they have less lip tissue. So you typically need less to see a bigger difference. However, I will again reiterate and say 1 syringe is much smaller than people think. A lot of times patients end up getting a little bit more. Number 12, you can get a reaction from filler. So you can get a reaction from anything. It's normal to be allergic to anything. I will tell you, it is very, very, very rare to have an allergic reaction to filler or Botox. Filler is made of hyaluronic acid. It is naturally found in the body. Botox is composed of botulinum toxin. So it is very rare for people to have reactions. I see more reactions from the numbing cream rather than anything else. I will say that a lot of times people think that they're having an allergic reaction, usually the night of their lip filler, just because they're so swollen. But you also have to think that lip filler, it's hydrophilic. Your lips are vascular, it gets attracted to the water, it swells up, they look huge, but I can assure you that they go down quite a bit. Number 13, they can mess up your facial features. They can mess up your facial features permanently. So it depends again on what fillers you're using, who is injecting you, and how many syringes you're getting. But I can tell you that again, all the fillers I use are temporary, so it is very rare that they can mess up your facial features permanently. Number 14, it is addictive getting Botox and fillers. There's nothing in the Botox or fillers that makes it addictive. However, I will say that a lot of people like the results. Like, quite simply that they like the results after they get it once or twice and they want to keep getting more. Doesn't mean it's addictive, no. But does it mean that people like it and want to keep getting it? Yes. And if they do, great, more power to them. Like me, I love getting Botox and fillers. Would I ever say I'm addicted to getting them? No, yet. But would I say that, I love the results of it? Yes, I do. Okay. How much does it cost to get Botox on the lips? So again, I asked like a pretty general, like, give me your assumptions about Botox and fillers. And this one's not really an assumption, but it also shows that people don't know that Botox and fillers are different. So Botox is a muscle paralyzer, and that's a brand name. I just kind of use it. It stands for botulinum toxin. However, there's Botox, Dysport, Xeomin, Jeuveau. So those are all the FDA-approved botulinum toxins in the United States. However, Botox is not typically injected in the lips unless you want, say, a lip flip, or unless you want like to help with a gummy smile. But a lot of times people think that Botox and filler are the same thing, and they aren't. So I just want to clear that up as well. Let's see, 16. Botox can paralyze the face if done incorrectly. So Botox, again, is a muscle paralyzer. So it is paralyzing the face. Can it paralyze the wrong muscles if it spreads or if it is done incorrectly? Yes, it can. However, the nice thing about it, it is temporary, so it does go away in about 3 to 4 months. Okay, number 17. How many vials does it take for a different procedure? So that's really like a broad question, but I can tell you that a lot of these questions can be answered by coming in for an in-person consultation. I get so many DMs asking me to answer questions in regards to their specific concerns. However, it's so hard for me to give like an honest, accurate answer if I don't see their face in person. So I typically recommend coming in for a consultation to answer that. Let's see. It is full of cancer-causing chemicals. So again, fillers, the ones that I use, the majority of the ones I use is composed of hyaluronic acid and or calcium. Calcium and hyaluronic acid naturally found in the body, but tell you that I have not heard of Botox or filler causing cancer or having cancer-causing ingredients. Okay, number 19, Botox can help with migraines. Yes, it can. So Botox is not just used for aesthetics. It is used for medical purposes such as TMJ, migraines. It's used for, sorry, I keep sweating. It's used for excessive sweating. So it is great, and it's something that I think should be really like smiled upon, I guess. Is that bad to say? But I think it makes people so happy, and I think it also helps people with medical concerns. Doctors use it obviously for aesthetic reasons, but they also use it for medical purposes. So yes, it does help with migraines. Last question. Sorry, I can't read my own writing. Your face will be frozen after. So again, with the amount of Botox that we are using, it's very hard to freeze your face completely. Like, see, I still have motion. However, you are paralyzing the face, so you have to keep that in mind as well. Let's see, but with filler and stuff, it is very hard to look like you've had a really, really tight facelift, just because there's just simply, you have to do a lot to really give you that frozen, like super tight look. It is very rare to get that look. I think people base a lot of their conceptions about filler from like movies, things like that. Sorry, again, I keep spitting. So your face, some people, they may look frozen, but the majority of the times patients look like themselves, but just enhanced. I'm gonna close this with saying one comment that I read actually recently, and so I'm just gonna read it, and I wanna just kind of elaborate it. And this seems like a common misconception that people have. So here's the comment. Usually the only people who look better after Botox lip injections are middle-aged people. I don't know if I've ever seen someone under the age of 45 look better after than before. So I can tell you that it is very common, especially now in this day and age, to get Botox and filler. Chances are your favorite celebrity, your favorite Instagrammer, your friends, again, your family members, your coworkers, chances are a decent amount of them have fiddled in the the world of filler and Botox, and chances are a lot of them you cannot even tell. I personally have a lot of filler and Botox in myself, and I think I still look pretty natural. I can still move my face. I am not frozen, and I will honestly say that I look, in my opinion, much better after the fillers and Botox than before. I think it enhances what I already have, and I feel more confident about it, and it, again, was my decision and no one else's. Just like everyone else, like it's filler and Botox, it's their decision and not anyone else's. So I think that before people are so quick to judge people that confess to getting fillers and Botox, I think people should really think like, you know, if it makes them happy, then why is it my problem? Like, why should I care about what they're doing? Because ultimately it's their choice, it's their body. Not only that, but usually, in all honesty, the people that criticize the Botox and fillers are people that have never tried it before. And I can tell you that if you've tried it and you don't like it, great, you tried it, you don't like it. But if you haven't tried it, but yet you're constantly criticizing people that are doing it and talking about it, then it looks bad on, it doesn't look the best on you, you know, you don't know much about it, but yet you're criticizing other people. So I think fillers and Botox, it's a personal decision, and it's everyone else, it's their own decision. So yeah, so I hope you guys liked this video. I hope you guys found it informative, and I hope you guys, I guess, subscribe. So thank you guys for watching, and have a good day.